Heat exhaustion is primarily characterized by the inability to continue exercise. Its signs and symptoms contain a rectal temperature below 104 degrees, excessive fatigue, syncope or collapse, pale skin, dehydration, diarrhea. They may or may not have hot and wet skin, may or may not have cool and clammy skin, lightheadedness, staggering, and minor cognitive changes including dizziness, headache, and confusion. Exertional heat stroke is primarily characterized by its signs and symptoms: having a rectal temperature above 105 degrees Fahrenheit, major CNS dysfunction, personality changes, combativeness, vomiting, fatigue, drowsiness, dehydration, syncope, headache, confusion, staggering, dizziness, diarrhea, and they may or may not have hot and wet skin. There are a few key differences between heat exhaustion and heat stroke. Heat exhaustion shows a rectal temperature about 104 degrees Fahrenheit, and they have minor cognitive changes. Heat stroke has a rectal temperature above 105 degrees Fahrenheit, obvious CNS dysfunction, personality changes, combativeness, vomiting, and drowsiness. When exertional heat illness is suspected, the patient should be removed from the playing field to a cool, shaded area if one is available. The best way to differentiate between heat exhaustion and heat stroke is to obtain a rectal temperature, preferably with a probe, but if one is not available, then using a flexible thermometer is effective as well. The clinician should wear gloves, have tape readily available, and clean the thermometer with isopropyl alcohol. Draping the patient appropriately before starting will provide privacy. It is optimal the patient is sidelined with the top hip and knee flexed, but in the event that this is not feasible, the patient may be prone. Turn the thermometer on. Lubricating the thermometer may be needed for smooth insertion. Placing a piece of tape on the thermometer can provide a scale so that you know it isn't far enough. Insert the probe 4 inches past the anal sphincter. If there is resistance, stop, take the thermometer out, and reposition it. When using a probe, tape it down to ensure it stays in place, and leave the thermometer in for the duration of the treatment. When using a flexible thermometer, it should be taken out and reassessed every 5 minutes. Once treatment has ended, remove the probe gently unless the patient is being transported. When the thermometer is done being used, clean it thoroughly. Use with sterilization solution such as Cybex 28-day plus cold sterilization solution. When treating heat exhaustion, move the patient to a cool shaded area, rehydrate them with oral fluids, remove any excess clothing, cool them with ice towels, ice packs, or dousing them with cool water. If they show no improvement, reassess their rectal temperature and consider transporting them to the nearest emergency department while continuously monitoring their vitals. When treating heat stroke, put the patient in a cold whirlpool that's 35 to 55 degrees Fahrenheit. Stir the water continuously and continuously monitor their vitals for any change in rectal temperature. Cool the patient until their rectal temperature is below 102 degrees Fahrenheit. Do not stop treatment and transport. Transport them to the nearest emergency department once the rectal temperature is below 102 degrees Fahrenheit. If there is no efficient way of cooling or any additional problems arise, transport them immediately and cool them in the ambulance in the most effective manner.